Because Session 2 is such a dense session, and some providers are limited to shorter 60-minute sessions, we've divided the content of Session 2 into two parts. In Session 2A, you'll facilitate a discussion of the common reactions to trauma. In Session 2B, you begin by introducing in vivo exposure and end with the assignment of the first in vivo exercise for homework. If you're able to see the patient for 90 minutes, both sections can be delivered in the same session. The agenda for Session 2A is simple. Review homework and self-report data, facilitate the discussion of common reactions to trauma, and assign new homework. As in Session 1, don't become so focused on the material that you forget to be your warm and genuine self. Let your client know that you're listening by expressing empathy and inviting input and collaboration. Finally, and I always say this because I forget sometimes myself, don't forget to turn on the recorder before you begin the session. The first part of this and every other session from now until the end of treatment is review the client's homework. Some therapists are tempted to move through this very quickly or skip it altogether, especially in earlier sessions because exposure has not yet begun, but homework review is important for several reasons, so you won't want to make this mistake. First of all, you assign homework and the client will expect you to check in about it. This is an easy opportunity to positively reinforce the efforts the client is making at treatment. Conversely, not doing so might give the message that homework is unimportant, and the client may be less likely to do future assignments. Nothing could be further from the truth as you move forward in the protocol, so set the standard now that homework is a critical part of treatment. Homework review is also where you find out important stuff about your client, like how well he or she is comprehending the material and what kinds of avoidance is happening outside the session. Avoidance shows in homework review more than anywhere else, so homework review also provides teachable opportunities to review the rationale or present it in a different way so your client is better able to successfully implement the treatment. As you review the homework, you'll learn a great deal about how your client meets the world and how his or her symptoms affect functioning. This will help you shape the treatment to best fit your client. At least every other week, you should also be having your client complete symptom self-reports. So if this is one of those weeks, you'll need to review those as well. You may not need to discuss or even comment on the self-reports every time, but make sure you have the client complete them and have a look at the numbers before the session. It may change the way you approach the session that day. Even if it doesn't, in some future session, you'll want to review your client's progress, and it will be too late to go back and get that data once the time has passed. So be prepared by monitoring progress along the way. Ongoing assessment is not extra or optional, it is a key part of treatment. The next part of the session is to discuss common reactions to trauma. In this part of the session, you'll review common symptoms that are part of PTSD diagnosis, as well as features that are associated with PTSD. Not every client will have all the symptoms on the list, but most will find many of the items familiar. This discussion serves several purposes. First, hearing about how others react to trauma helps to validate and normalize the client's experience. They are not alone in their suffering. Others have experienced similar reactions, and those reactions are recognized and understood as responses to a trauma. So even though the discussion of common reaction reviews some pretty difficult experiences, it's reassuring to hear that someone in a position to help is knowledgeable about the impact of trauma. If you present this section as an entree to conversation, you'll hopefully elicit a more full and descriptive account of the ways PTSD affects your client as well. Demonstrating both empathy and interest, ask for specific details about the kinds of reactions that bother your client the most. Establish this kind of fine-grained analysis as a pattern that you'll follow throughout treatment, examining behaviors, thoughts, and emotions in detail without fear or shame to learn the best ways to work with them. The list presented here is just a starting point for conversation. Use it to find out more about how the client experiences symptoms and how PTSD has affected his or her life. This will be very helpful later in the session when you're creating and refining items for the in vivo hierarchy. I want to take a moment here to talk about language and the meaning of words. We often think of PTSD as a fear-based disorder, and when we discuss common reactions with clients, we often use words that indicate this, like scary, fearful, anxious, dangerous, etc. However, some survivors of trauma are put off by this language. Some will not recall feeling afraid at the time of the trauma. This is especially true for combat survivors whose training and experience teach them to focus on the mission rather than their emotions. Still, others did experience fear but may be unwilling to acknowledge it, because fear sometimes gets tangled up with shame and guilt. Using a word like distress instead can feel less negatively charged and may be more acceptable. So regarding language, be tentative when discussing clients' experiences. Use a variety of words and phrases, ask for confirmation and correction, and invite clients to label and characterize their reactions in the way that feels most accurate for them. Use their words going forward and check in to see if you need clarification on the meaning of a word or phrase. As you listen, make notes about the things your client finds difficult or distressing, or things your client avoids. Pay particular attention to safety behaviors. Safety behaviors are extra things your client does that enable them to do activities they would otherwise avoid. These include things like bringing along another person, taking a special route, or sitting in a certain place so they feel safer. These behaviors don't actually contribute to safety in a meaningful way and can interfere with habituation. You can also make note of themes, beliefs, or thoughts that might stand in the way of recovery. These include feelings of incompetence, guilt, or self-blame, and unhelpful thoughts about danger and safety. Though you won't be implementing cognitive restructuring in a formal way during the common reactions discussion, you will have a chance to return to these themes and beliefs in later sessions while processing exposure exercises. If you're implementing both parts of Session 2, you'll introduce in vivo exposure next. That material is covered in the next session note recording. If you're only presenting Session 2A, you'll assign homework next. Homework for Session 2A is to review the handout about common reactions and continue to practice relaxed breathing. The client may also wish to share the common reactions handout with significant others if appropriate. As you finish up the session, check in once more for any final questions. You've completed Session 2A for PE.